Robert F. Kennedy Jr.'s latest comments on the measles vaccine are not just scientifically inaccurate, they are deeply irresponsible, especially coming from someone in the nation's highest public health office. While he did issue a nominal endorsement of the measles vaccine, calling it the most effective way to prevent the disease, Kennedy undermined that same endorsement by pushing several false claims that sow confusion and erode trust in one of the most successful public health tools in history. In his remarks, Kennedy falsely claimed that measles immunity wanes very quickly after vaccination and suggested that outbreaks are inevitable regardless of vaccination coverage. This statement flies in the face of decades of data and directly contradicts the findings of immunologists and infectious disease experts. In reality, 2 doses of the measles, mumps, and rubella (MMR) vaccine provide robust, long-lasting, often lifelong, protection. That's because the vaccine trains the immune system to develop memory cells that can rapidly recognize and neutralize the virus if re-exposed, preventing infection from taking hold. If immunity truly faded as quickly as Kennedy claims, the U.S. never would have achieved measles elimination status in 2000, a milestone that took years of consistent vaccination efforts to reach. His comments also dangerously distort the reality of the current outbreak. There have been 668 measles cases reported in the United States so far this year, the highest number since 2019, including 2 confirmed pediatric deaths and another suspected adult death. These tragedies are the direct result of undervaccination, particularly in communities where vaccine hesitancy is high. To blame these outbreaks on waning immunity rather than low vaccine uptake is a blatant misrepresentation of the facts. It not only shifts attention away from the real cause, but also gives cover to anti-vaccine rhetoric at a time when clarity and trust in science are critical. Even more disturbing is Kennedy's repeated suggestion that the measles vaccine hasn't been safety tested. This is flat-out false. The MMR vaccine has undergone rigorous evaluation, including randomized controlled trials and post-approval safety monitoring over decades. It has one of the most thoroughly documented safety profiles of any medical intervention in use today. Kennedy's assertion that vaccines are only tested for 3 or 4 days with no placebo group is not only misleading, it's a cynical twisting of scientific methodology. Many vaccines are tested against active comparators, or previously approved vaccines, because withholding protection from a control group, particularly in pediatric studies, would be unethical. The claim that using these comparators instead of saline placebos invalidates the results reflects a fundamental misunderstanding or a deliberate misrepresentation of how ethical clinical research is conducted. Kennedy's ongoing skepticism about vaccine safety is not a neutral position. It actively undermines public health. He has repeatedly questioned long-standing scientific consensus without providing credible alternatives. His comparisons to Europe, for example, where he cites 127,000 cases as justification for his approach, completely ignore critical context. That number spans 53 countries and an entire year, whereas the U.S. numbers he's referencing reflect just a few months. It's a classic bait-and-switch, meant to deflect blame and paint a misleading picture of global measles trends. The danger in Kennedy's statements isn't just in what they get wrong, it's in the trust they erode. As Health and Human Services Secretary, he is expected to lead with evidence-based policy, not personal ideology. His legacy as an anti-vaccine activist has already made him a polarizing figure in public health, and these recent comments only deepen the concern that he is more interested in validating fringe views than in protecting lives. Doctors across the country are warning that his words could accelerate vaccine hesitancy, potentially leading to further outbreaks, hospitalizations, and deaths, many of them preventable. While some of his advisors have tried to spin his critiques as valid concerns about transparency in vaccine development, those attempts fall flat in the face of science. The overwhelming consensus in the medical community is that vaccines, especially childhood immunizations like the MMR shot, are among the safest and most effective interventions available. While ongoing research and safety monitoring are essential, those processes are already in place, and any serious safety signal is met with immediate scrutiny and action. It's one thing to demand higher standards in scientific research. It's another to mislead the public by distorting the facts. Kennedy's remarks do not reflect healthy skepticism. They reflect a dangerous disregard for the truth, and they risk turning a manageable outbreak into a national health crisis. When the person tasked with safeguarding the nation's health uses his platform to cast doubt on proven medicine, the consequences can be measured not just in confusion, but in lives lost.